So yeah, I guess first and foremost, I'm really curious. Steph, you had mentioned that some of the agents had some questions, so I kind of want to treat this as an open forum to answer any questions or concerns that people might have about moving to Spark. I think we can start there, and then if there's an opportunity to maybe do somewhat of a platform demo, we absolutely can. And then ultimately, I'd love if everyone's on board to get some contracting done. We can run through a contracting form together. So I want to throw all that out there and see how it lands.
Zach, was your Anthem question about the appointment fees answered?
Yeah, yeah, because they transferred over like all my states, and one of them was Virginia, and I don't even really have any business there. It's just a forever state license that I have that I got so long ago that basically they're trying to charge me fees for that, and then a couple other states as well. And I'm pretty sure I already paid the fees a while back, so I didn't know. I was getting through the Anthem contracting, but I didn't complete it because of that.
Yeah, I think when you're going through it, when you went through our contracting form, if you have gone through our contracting form, did you leave the states off that you didn't want to continue on with?
Uh, Honestly, I don't even know if I did your contracting to I I'm not sure.
Check.
Let's see. New
Sorry, I'm
contracting.
just gonna jump in just because I did the Anthem one and it did come up with fees. And as far as I understood, is if you already paid it and you're already active with Anthem, it's a whole new contract, so you just got to pay the fee if you want to be active in that state. So I paid them and I processed them, and they said if for whatever reason it does transfer, you just would either be reimbursed or it wouldn't be processed. So that's just from my kickback.
I think that's good input for sure. And Ryan, this might be a symptom of that dual appointment that we're trying to figure out because we're contracting new with Spark. I believe that's probably what's happening.
Okay. So do we tell people to pay the fee if they're not sure?
If they'd like to get contracted with Spark, I would be more selective with the states that they're selecting more than
Okay.
likely, so that they're not paying 50 states worth of fees, and just make sure that you're only selecting states that you're going to actively be writing business in, not like it'd be good to have this just in case kind of situation. So that would be my recommendation. But because we are contracting iHealth and your agents as new to kind of accomplish that dual appointment that you wanted to go for. I think that's going to be the best answer for sure.
Okay.
Okay. Is this remind me, is Anthem like a just-in-time appointment? Like if I'm in a bunch of states, but I'm not in Kentucky and I have a client that wants to buy the Anthem Medicare Advantage plan in Kentucky, can I do that same day, or is that where you'd have to do that like ahead of time?
That's
Or
uh, that's a good question for contracting, honestly. Let me take a note here. And you called it a just-in-time state.
I mean that's what some carriers call it, is just in time, where you can literally just get appointed as you submit the application. But maybe there's a list for Anthem somewhere. I want to say I've seen it a long time ago.
Hmm. Okay, cool. Yeah, let me go back to contracting on that one and see if I can get you an answer.
Okay.
Um, was there any other kind of big call out concerns or thoughts on moving to Spark before we move into more of a demo?
Uh, Karina, I know you were having a bunch of issues. Uh, Sam, just to kind of recap, Karina was kind of in the middle of like a horrible timing where she got contract with senior market sales for some carriers, and then we had to transfer those. And I think there was one or two maybe that were in um, in limbo, and um, I'm not sure if those got resolved, Karina, but now's a good time to kind of address those if you.
As far as I'm aware right now, I did get in contact with somebody on the back end from Spark that did confirm that it was just like a glitch, but everything was completed and everything was submitted. And they did update that. So it is now reflecting. I don't see any RTS changes on my end yet. But that's a whole separate contracting thing on the carrier side. So And my whole thing was just figuring out what exact upline was listed just because there were so many DBAs and like things like that. So sorting that out. Yeah.
There's so many. Yeah.
Yeah.
Just the
Got
word senior, there's like 19 or 20 different companies with start with the word senior.
Oh yeah. Yeah. It was a mess, but so far I think we're finally cleared up for right
Okay.
now.
Okay, excellent. Yeah, I do see, Karina, that you're ready to sell with Aetna, and then in a transfer window for Humana, WellCare, and Cigna. For a few others, Anthem, Aetna Sup, and Cigna Sup. Once iHealth is ready to sell, you'll also become ready to sell.
Okay.
Molina's in a blackout right now. And then there's a few more, United, WellCare, BCBS Arizona, and Anthem that might be waiting for an update. It says contract sent on our system, but if you've already completed links for those four carriers, we're probably just waiting on carrier reporting to update those for you.
Yeah, I definitely on the first round when I did the contracting, it was only showing a portion or only a selected few. Then y'all were able to open up another set, which I did send in later.
Okay.
I did fill out everybody's emails and do all the forwarding and all this stuff. So I think it's just a matter of letting them do their thing and giving us a response. So
Okay.
yeah.
Perfect. Perfect. And Zach, let me check into yours. You said you hadn't yet completed the contracting form.
Yeah, I'm not sure if I did or not. I mean, I was doing a lot of stuff with Medicare, and my brain's like fried. If I did it, it would have been about a month or so ago, but
Yeah, it doesn't look like we have gotten a contracting form for you yet. I can drop the link in the chat here, if you'd like
okay.
to go ahead and complete that. It is pretty straightforward, but if you wanted to share your screen and run through it together, we could certainly do that. But again, it is pretty straightforward.
Okay. Yeah, I can do it. You don't have to walk me through. I can do it on my own, but
Okay, cool.
so you can save the time.
All right, so I just dropped the link in the chat there for you. Feel free to fill that out. I do see that you moved in bulk with the agency though for a couple of carriers, so that's pretty straightforward. You're already ready to sell with United and Aetna under Spark. The contracting form that you're going to complete is really just kind of making sure all the I's are dotted and T's are crossed, and that we have all the information needed to process further contracts in the future. So, yeah, if you can get
Okay.
that completed, we'll be in a good place. But like I said, you're transferring with the agency for most carriers here. Um, so it's just kind of a waiting game at that point in
Okay.
time.
And is that with like so I got UHC, Aetna, and then the other I mean, I don't use every single carrier, so like the main ones would be like WellCare, Humana, um, what other ones? Obviously Anthem, I gotta complete. And then maybe Cigna.
Yep. So right now, if you when you're filling out that form that I just sent you, you can select that Cigna contract. Anthem, it looks like we may have already sent you in advance of the Anthem deadline. Uh, Now, Ryan, are all agents expecting releases? They are, right?
Yes. I mean, any agent we had with seed market sales, we got a release that included all the carriers, with the exception of maybe one. But like
Okay.
Karina was like the one that she she was like in transition, and then she changed resident license state. So um, I don't envy her position.
Fair, fair. Yeah, that's tough. It's a tough timing for sure. Yeah, so Zach, just fill out the form with all the carriers that you'd like to pull over. And since you're included in that general release for iHealth, you shouldn't have to worry about any of those transfer without release deadlines. So yeah, whenever you get a chance to fill out that form, I would say as soon as possible, just in case. But you should be in a good place.
Okay. Thank you.
Yeah, of course. Now, in terms of Spark as an upline, Spark as a technological platform, were there any questions or concerns there?
I submitted one app and it was pretty easy. Um, I did the intake form. I sent that to the client. They filled out their doctors, their drugs, and the scope all at the same time. So when they submitted, I got a text and email confirmation that it was done, and it was a lot of it was worth the headache for all the contracting if this is how easy it's going to be. So maybe if you want to walk through like uh, quote to application, or I don't know if Zach or Karina have a actual prospect you want to use, we could watch, do it together and kind of get that out of the way. If you
Yeah,
have one.
I don't know if I could do an actual prospect, but let me log into my my demo platform here, and I can run you through a couple of the cool tools that we have that will definitely make some of the contracting headaches worth it. I do appreciate how you phrase that, Ryan. That's it's a good call. I mean, contracting is frustrating no matter what. And of course, am I frozen here? There we go. But yeah, the tools that we have available to you really do uh, kind of make up for that headache that is contracting, I would say. So let me share my screen.
And then if you have time, I hope you have time to go over like the happy birthday cards. I
Oh
think
yeah,
that's a
yeah, yeah.
cool feature that people will definitely want to consider. I will do it for sure.
Yeah, absolutely. All of our retention campaigns are honestly really great. So this is what you log into when you get access to the Spark platform. Karina, have you been on yet? Have you logged into your platform?
I have. I
Okay.
have. I think I entered like one contact. I didn't have anything to transfer in, but I've kind of like toggled around and stuff like that. Yeah.
Okay, cool. So high level overview, I mean, this is your homepage. It just kind of shows you your book of business broken down visually. You can click into any one of these things, and it'll filter your book of business. That's going to be your contacts page here. We also have a support request tracker down here. Something that I'm not sure that you've kind of been filled in on is we actually have a client-facing support team, so a beneficiary-facing support team that will work directly with your beneficiaries to solve problems for them. Think of like billing issues, provider searches, transportation scheduling, appointment scheduling, all of those things. We have a team that will help you with those things or help your beneficiaries with those things completely free of charge. Um, Every single agent on the Spark platform gets 50 of those requests per year, and most agents don't get anywhere near that 50 mark. But I highly encourage you guys to use it because those are the types of things that a beneficiary will call you about and will take up hours and hours of your day when you can be focusing on writing more enrollments rather than, chasing down a billing issue. So this little tracker right here is cool because you can just kind of see how many requests, how many requests you've used this year, the client satisfaction rate, and then the hours saved box at the bottom there. I love to give our top user a lot of credit. She saved like 1,000 hours in the last year using the client support requests here. So highly encourage you guys to use those, and I'll show you how to file a request in a little bit. We have 7 tabs here. We used to have 8, but we've kind of consolidated a little bit with this back office button, which is actually where I want to start. So you have the back office. You can keep track of your carrier contracts here. Those are all your carrier contracts that are with Spark in one place rather than jumping around from carrier portal to carrier portal. You also have this marketing tab, which is what I want to jump into now because it kind of sets up the rest of the platform for you. So once you get to the marketing tab, you have this marketing profile button. You can customize this as much as you want. So you can change the color scheme and logo, update headshots, personal information, things like that. You also can jump into this edit field here, and you can see you have different fields that you can update. Say you have a business website, a scheduling link, all of those different things you can add here. Reason being, if you come back over to your marketing tab here, every agent on Spark gets a pre-built agent web page that you can distribute, and clients can jump onto this web page. They can learn a little bit more about you. If you have a scheduling link, it'll show up here. So, like if you have a Calendly, people can come to the site, click on it, and schedule an appointment with you. You also have the opportunity, or a client has an opportunity to explore plans with this button. And the cool thing about that is that it's a personal URL link, meaning that if a client clicks on that button and goes through the entire enrollment process themselves, which I'd love to show you if it would speed up a little bit here, you'll still get full credit for that enrollment because it's your link. So you can be enrolling people without even having to meet with them, without having to lift a finger, and get full credit for it. So, like I said, client clicks on this link, they fill out some information. It's fully white labeled. There's your headshot and phone number in the upper right hand corner. They can complete an enrollment without you having to do anything, and you still get full credit for it. So, like I said, you have this marketing profile, and it sets up the rest of the platform for you. So we have all of these marketing materials available to you that are completely compliant with both CMS and the carrier. Uh, and they are fully white labeled. So everything in here you'll see, you have a headshot, contact information, color scheme, logo, all with the goal of keeping the agent in front of their book of business. These are really nice to have for seasonal or seasonality. So you have like AEP flyers, AEP social media posts, things like that. But we also, like Ryan said, have pretty amazing retention campaigns. So I'm going to go back to the back office, and then we'll click on this client retention button right here. So we have a series of different email campaigns that go out every year. We have a monthly newsletter, so that's once a month, 12 emails that go out directly to your enrolled clients, and they're fully white labeled as well. So headshot, color scheme, logo, it's all preserved and shared with the beneficiaries in that monthly newsletter. It's a newsletter, so there's Medicare relevant information, but there's also things that you would expect to find in a newsletter. Think like recipes and fitness programs, things like that. We also send out new plan enrollment announcements. So when a beneficiary enrolls in a new plan, they get they get an email. I believe they also get a postcard with more information about that plan. And then we have an AEP campaign. The AEP campaign is 5 different emails. It includes a needs assessment, which is basically an intake form, so that you can collect all of that beneficiary information prior to a meeting with them. And Ryan also mentioned the birthday cards. This is the only thing on the platform that's pay to play. It's $250 per card, but they automatically send to your book of business, to your beneficiaries in your book of business when you have a birthday or when they have a birthday coming up. So again, fully white labeled, handwritten, looks like it comes from you, and you don't have to lift a finger for them to go out to your clients. I know that my 86-year-old aunt really appreciates when I send her a card. I try to do it multiple times a year because I get super brownie points for doing that. So I highly recommend you guys opt into these as well, because I know that senior members of our society really love that. Um, Ryan, I
Can
saw you.
you choose which people to send it to, or is it either all in or all out?
I believe it's all in. Yeah, all in or all out. I think as if you have them enabled, they automatically send to your book when they have a birthday coming up.
Because it says new plan enrollments, monthly newsletter, AEP campaign. So does that mean like just new plan enrollments get one the next year, or prospects? Or I guess it's all
So
clients.
this it's all client, it's all beneficiaries. So the retention programs only go out to beneficiaries. So you have new plan enrollment announcement will go out when you enroll someone in a new plan, and that also includes a mailer. Whereas the birthday cards are a separate feature to that.
Okay. If we as an agency wanted to cover, like an amount, let's say $50 an agent, is that something that's possible, or is it easier we just send agents like, a cash or something, $50
Yeah.
credit?
You can absolutely cover those expenses. We have many agencies that do that out of their co-op funds. We basically you just have your agent request a reimbursement for it from you.
Okay.
Yep.
Quick question
Yeah, yeah.
about cards. Are you able to personalize them at all, or is it just like a general message that you select from?
Yeah, at this point, it's a general message. We have heard that feedback that it'd be nice to customize them to some extent.
Yeah,
The tricky part there is compliance. CMS is a pretty big stickler for making sure that all communications are compliant. So we do have to limit the editability of certain things, including the marketing materials, to maintain that compliance with CMS.
fair. Okay, thanks.
Yep, of course. Um, so now I want to show you a cool way to generate leads. So Zach, I'm curious, like when you're out in the market generating leads, how do you do that? Do you have like referral partnerships? Or are you doing in-person events, things like that?
Yeah, I don't do any in-person stuff. Everything's over the phone, but I got a lot of under 65 clients that either age in, and then I get a lot of referrals, and then I also have referral partners that maybe don't do health insurance that will refer me people.
Okay.
Um, so yeah, that's mainly how I get most of my clients, or if we get new leads that come in through our websites or call-ins.
Got it. And what kind of partners or referral partnerships do you have? Are they like pharmacies, providers' offices, other?
I have some accountants, so I'm in like 25 states, so they're kind of spread out there all over, like some life insurance only agents, some, guys that just do like the PNC, property and casualty, or maybe work or captive agents with like State Farm or Farm Bureau.
Okay.
Like things like that, and then just people that just don't do health insurance at all because they just don't like it. Um,
Fair. I think accounting is a good example to run with here. So let's say you have an accountant's office that you want to generate leads from. You could put a flyer in their office or something, or you could, have them circulate a link for you, say like to their mailing list, say, hey, this is Zach. If you need health insurance, reach out to Zach kind of thing, and click this link to get more information. So what we'll do, we'll come over to our sources tab here, and we can create a source. That way we can track those leads coming in. So we'll say, accounting office flyer. And we'll add that source. You'll see it pop up down here. Right now we have 0 contacts because this hasn't been distributed at all. But like I said, you can copy a link here. You can drop that into an email template that you then give to that accounting office that they circulate to their email list, or you can create that flyer and say, okay, I'm going to hang this flyer in this office, and it's going to have this QR code on it. Now, that QR code is going to enter people directly into your book of business. So actually, Karina and Zach, if you don't mind, go ahead and scan that. And I want you to see the workflow of what that looks like. So when it opens up, you'll see it's fully white labeled. All the agent information is there, the logo, color scheme, all there. And I'm just going to put a profile in here to run the demo with. But feel free to also put a contact in. It can be, your favorite superhero, your pet. I'm using my pet. I always use my pet. Um, but just again, so you can see the workflow. So once that the client has entered their information, they do have an opportunity to complete the intake form right then and there. But if they don't, it's no big deal because you can send it to them a bit later. So I'm going to come back over here. I'm going to reload. You'll see that one contact now. That's the contact that I just added. So if I click on this accounting office flyer, it'll jump us to the book of business. There we go. So all 3 of these new leads that we just generated using that QR code are automatically entered into your book of business. Any contact information that was already added will be there automatically. But obviously, we need a lot more information to enroll my dog into a Medicare plan here. So we're going to come over to Maisie's profile, and you'll see this connect menu here. The connect menu has a bunch of different actions on it. Try again later, it's basically sending yourself a reminder. You can add a customer reminder. You can change their eligibility status. But we're going to send them a needs assessment. That's our intake form. So you can click continue on send needs assessment. You can either email it over, or you can create a link that you can text over to them. And we'll just grab that and drop it into here. And this is what, well, demo account does that sometimes. There we go. This is what the client is going to receive from you. So again, this is something that they do on their own. You don't need to sit down and kind of collect all that information for them. It shows up fully white labeled, logo, headshot, color scheme, contact info is all there. They're going to go ahead and start the survey. And I'm going to run through this pretty quickly, but you'll see the functionality is really kind of amazing and saves you a ton of time here. So they'll enter their address. They don't currently have any health insurance, Medicare friendly age here, no Part B, continue there, no veteran benefits, no extra assistance or chronic conditions. She is currently on fluoxetine because she's a little stressed out from time to time. She's getting the 20s and she's 30 a month. So we'll add that prescription. Done adding drugs. Continue. There's a Dr. Smith in town here that she loves. There we go. No additional healthcare providers, but there is a CVS right down the street. There it is. So cool. Submit that. The beneficiary just entered all that information for you. So you're not, again, sitting down at the appointment and entering it for them or having to take time out of the appointment to do that for them. Especially if you're Telephonics Act, like having this filled out in advance, like you can just get down right to the nitty-gritty of finding a plan that works for them. So from
So
there,
they can, sorry to interrupt. So
yeah,
they
go
can
for it.
send that, you can send in need assessments before they sign the scope of appointment.
You can. It could be because of the intake form, because that QR code is a PTC. So by filling out that QR code, they've given you permission to contact them.
Okay.
Yeah. So you can then go on to the scope of appointment. If you send this link out knowing that you have an appointment with them within 48 hours or so, I would always encourage them to go ahead and fill out this SOA. If not, they don't need to. You can send an SOA over later. So we're going to come back to Maisie's profile here. It'll reload, and you'll see all the information that they just provided for you will now live in the platform. So the address up at the top here. There are some, just general actions that have been taken in the platform. You generated this lead through the accounting office flyer. You sent them an intake form. They completed the intake, or they started the intake form and completed it. The healthcare tab will show you their prescriptions, their pharmacy, their PCP. If they'd given any Medicare information, it would show up in this box here. And now you have everything you need to quote and enroll this beneficiary, this client. So we'll go over to the quote and enroll tab. Like I said, if they haven't already signed an SOA, they can sign it right there, or you can sign it with them in person, or you can send it to them in advance. Again, it depends on when the appointment is, how you're going to handle that, but you always have an opportunity to follow up with an SOA if need be, and they are kept on file indefinitely as well. Going back over here to the quote and enroll tab, we can now launch our Sunfire instance. So our Sunfire instance is fully integrated with the platform, meaning that everything that just happened in the platform will port over to Sunfire. So we won't need to re-enter any of that information that the client already entered for you. You'll see right away, zip code, provider, drugs, all of those different things that are pertinent details for enrolling a beneficiary in a plan will automatically populate. So you'll see right across the top, there's the zip code, there's the pharmacy and drugs, here's the provider, and here are a couple plans that it spit out right away that client is going to be eligible for. So a couple cool things you can do here. You can compare these plans, and you can do it in person if you're sitting down with the client, or you can email them over if they want more time to review it. And if they actually review it through that email and then go ahead and enroll themselves, you still get full credit for the sale because it's, again, a personal URL link. Once that beneficiary enrolls themselves in a plan, say Maisie wanted to pick this Aetna plan, and you completed the enrollment, that would talk back to the platform, and that information would show up in the Medicare detail box here. So saves you a ton of time in terms of data entry, in terms of ease of enrollment, in terms of just using one portal to do a quote enrollment rather than having to jump through a bunch of different carrier portals to make it happen. Last thing I want to show you is that client support tool I alluded to earlier. So we have this client support tab. You can just click add a request here. It'll pull the beneficiary information from the contact page. You can hit continue and select from the list of different things that our team helps out with, including other support, meaning that if you're not sure that we handle it, our team will still do our best to make sure that beneficiary gets the help they need. But they go above and beyond. And when they do a provider search, it's not just dialing in a zip code and a Medicare ID. They put in that information, pull the list, and then they call through the list to make sure that the provider is actually accepting new patients and that the provider is actually accepting the Medicare plan that that beneficiary is on. Once they have a confirmed list, they'll call the beneficiary back and say, hey, like, here's a list of people that would work with you. If one of these sounds good, do you need help scheduling an appointment? Do you need help scheduling transportation? They really do go above and beyond. So highly encourage you guys to utilize that feature as well. Ryan, was there anything else that you thought we should cover today?
Um, Did you already go over the scope? I know like the scope is separate, but once they could do the intake form, like you said, it kind of qualifies as a authorized contact.
Yep, yeah, and we ran through the scope quickly as well. Yeah,
And then the contracting for new carriers.
good call. So back to the back office tab here. You have your carrier contracts page. And what that will do is show you all of your carrier contracts throughout well, it will show you all your carrier contracts that you have with Spark, all in one place. It'll show you your carrier contract status. And if you have instructions or steps that you need to complete, we provide very explicit instructions. So you see that Ava needs to complete her certs for Cigna. She can click through to that link. And we give a step-by-step guide on exactly how to complete those certifications, down to where to navigate from or navigate to, what email address to look for, so on and so forth in order to get ready to sell. When you want to get a new contract, once you're on the platform, say you want to pick up a new contract, you can hit this request a contract button in the upper right-hand corner. And that will bring you to a contracting form similar to the one you fill out when you first onboard, where you can select the new contracts.
And then for open enrollment, or AAP, is there like a mass email option in here to do like intake forms, or like if a client or prospect has their information already added, medications or doctors or both, will it automatically just sit in there until it's active, until it's updated?
It will, but
Okay.
you can go ahead and send out mass needs assessments, those mass intake forms, in order to update your book of business. That's also included in the AEP campaign, but you can do it at any time. So the context tab here is actually your entire book of business, and you can do a few cool things with it. You can actually create custom reports. So say you only want to reach out to people in, let's say, Florida. You just want to reach out to your Florida clients and you want to get updated information from them. So we'll go ahead and click View Report. That'll spit out everybody who is in the state of Florida. And then we can come back up to this little button here, click the drop down, and email a need or a bulk needs assessment. So that'll email that intake form to every single person on that list. That way they can fill it out and update all their information in your system for you.
Cool. I forgot my last question. In the intake form, or if I have a prospect and they give me their Medicare number, I saw when I applied or got quotes for somebody, it would, if I put in their Medicare number, it'll spit out their Medicare A, B start date, their address.
Yep.
Is that going to be for anyone with a Medicare number? It's going to have all the information?
So that's going to be part of the manual contact ad. So if you are sitting there, if you get a phone call or you're sitting down with someone and they say, "Oh, I already have Medicare information," one, they can put it in during that needs assessment form. They have an opportunity to enter all of their Medicare information. But if you just get a phone call and you want to run them through the process, you can go ahead and click Add a Contact, and then you have this beneficiary lookup tool here. With the beneficiary lookup tool, you can either use their MBI or other contact information. That'll be their first, last name, date of birth, and state. I do find adding the Social Security helps return more accurate results. But yeah, you can either use the MBI or that other contact information, and it'll pull everything that exists in CMS into a contact for them.
If I give you a Medicare ID, would you be able to show it?
Yeah, absolutely. Go for it.
Pulling it up. Okay, I will paste it into this chat.
Sure.
And while you're figuring this out, right, is Sam, I know you're in the page right now, but obviously it's a new platform. Some of my other stuff is in the old database. Is there a way to import that information into Spark?
Yep, absolutely. So once you get onto the platform, you'll have an opportunity to upload your book of business in bulk. What I recommend is pull that book of business from as many places as you have it, whether it's in an old CRM or in different carrier portals, pull everything and then upload all of those files, and our team will go through and scrub the duplicates and organize the data so that it fits nicely into the platform for you.
Sweet.
Kelly, are you on here? I think I know we uploaded the C market sales contacts and prospects, but it might be just mine. I'm not sure if it's like for everybody, but
It's most likely just yours.
okay.
Ryan, do you have the date of birth for that MBI?
I do. It's 8/14/51.
Oops, crap. Oh, 8/14/51, you said?
8/14/51. Yep.
Let's go ahead and do you, it doesn't need to be their phone number, so let's just throw that one in there. Continue. There we go.
So it
So there,
pre-populates their A start date, B start date, the current plan, which is WellCare, Part D. It won't populate the Medicare supplement, correct? Because it's not part of CMS.
correct, yeah.
Okay. But if there was an Advantage plan they were on, it would show it here.
Yeah, but I believe it does pull all history as well.
Okay.
Yeah. Yeah,
If you scroll down, does it pre-populate their address too?
So that would be beneficiary details.
If you hit yes to home address, does it do anything? Okay. I thought it pulled the address on my one person that
I think it's going to depend on what CMS currently has in their system. I don't think it's going to be 100% on the address, though.
okay. So
Yeah.
like
Will it show LIS levels by chance anywhere if they did have LIS?
I am not familiar with LIS. What is LIS?
No, it's like the low income subsidy levels,
Got it.
like different tiers for their prescription coverage and stuff like that to know what they would pay for their copays.
Yeah, I am not entirely sure on that. It might fall under the extra assistance tab here. There it is. Yep. So if they
Oh,
have,
there it goes.
yeah,
Awesome.
there it is.
yeah, I think it should pull up Karina, because the yeah, anything with Medicare is going to have on there. So it might be like a DSNP for sure, but
Okay.
yeah, NLIs too. But
Perfect.
the first one you do, maybe confirm that with me so I can let everyone else know.
For sure.
Okay.
Cool. Yeah, this is a brand new tool. So I encourage you guys to use it, try to break it so that we can continue to improving it or continue to improve it. But yeah, once you get all that info, you save and exit. That contact is now created with very little effort on your part there. Let's see, Ryan, did you have any other features here that you wanted to go over? I mean, I do think that one of the best things to do once you get access is just kind of go in, poke around, and use the help center, which I should call out down here. The help center is a huge tool that I use on a regular basis. Every single page on the platform has this need help bar at the bottom. You can select a different segment where you might need help from this drop down. So say you need marketing help, here's some resources, your marketing materials and your marketing guides. But you can also jump to the Help Center at large, which is, again, a huge database, a huge library of information about all things Spark platform. So definitely leverage this as you're getting ramped up in the platform. And also feel free to leverage our team. We have one email address that you need to remember. It's support@sparkadvisors.com. Direct all your questions there. It goes to the right person because it's very intelligent email address that auto routes to the right person. And yeah, I think that's one of the best ways to learn the platform is to just get in there. Zach, once you complete your contracting form, you'll also get invited to an agent onboarding session. I definitely recommend attending those agent onboarding sessions because the platform team does a really good job at taking a slightly deeper dive into different platform features than we just did.
Okay.
Cool.
Where should they submit those tickets? Just using our own email, or is there like a setting on here to request it from a policy? If I needed something for, like, I don't know, member needed a new ID card or wanted to confirm
Got
they
it.
paid.
So there's a couple of different ways you can do that. The first way would be is someone in here right now? Oh, there I got filters. Okay. The first way to do it would be through that contact card. You can come to, the contacts profile, and then you go over to the client support tab. You hit add a request. From there, you can just continue on as normal because it pulls all that client information. The other way to do it, you go to the support tab. Excuse me, I'm gonna sneeze here.
Bless you.
Thank you, Zach. I was trying to fight it off, but it got me. All right. So the other way to do it, you come to the client support page here and you go request client support. Only difference being then you just have to select which which client you're working with and then hit continue. But basically, the email address on file for that contact is the email address that our team will reach out to or phone number. We also have a client-facing phone number. So if you have a client that's like, oh, I need to talk to someone, you can just give them that phone number. They can call our team. And the coolest thing about that is if our team is able to handle their issue on that first phone call, it doesn't count against your ticket allotment. So it's basically a free support request.
And just so that I'm 100% understanding, this request goes to Spark. It's not going to, like, we're not sending it to carriers. We're not doing an outside call center.
Correct. It comes directly to a Spark employee who
Awesome.
who acts as your representative.
Fantastic. Thank you.
Yep.
How many requests you said each agent gets?
You get 50 per year. Yep.
Is there a way to see how many you have?
Yep. So on the home page here, it tracks how many active requests you've
Okay,
had.
perfect.
But I will say, if you go above that 50, we do sell additional packs of 10 for $300. I can't, I don't want to overpromise here, but there is some talk about doing away with the 50 maximum. So stay tuned for more on that potentially. But for the time being, it is 50 per agent. And like I said, most agents don't get anywhere near that 50 mark.
And quick question. So let's say your client uses it one time, right? You refer them to the phone number, they call that phone number. Let's say later down the line, they call that number directly instead of calling you first. How does that work? Is that still counted as a new ticket? Is it there a way for us to track that? Will we be notified that they called in?
Yep, you'll get notified. So that their phone number, we only work directly with beneficiaries, and we tie those beneficiaries back to their agents. So our team will find them in the system as a client of yours and tie that support ticket to you, and you will get notified of it.
Perfect. Okay. Thank you.
My last question is on the quoting. I know is it CSG Actuarial or Sunfire? There's hospital indemnity plans as an option, but can we just quote those, or can you actually apply for those through Sunfire?
I will say the ancillary programs are in kind of the build out phase. We actually just hired a director of ancillary, so we expect big progress to be made on ancillaries going forward. Not just with like picking up new carriers, but providing more functionality to quote and roll. So I would say more to come on that. But for the moment, it is relatively limited.
Okay. So
What
just
kind
use the
of
carrier
product
sites.
you talking about, Ryan? Are you talking dental and vision add-ons if they're getting a supplement or?
Yeah, I guess I was thinking more of like the hospital indemnity, like the GTL and
Oh,
Medica
okay.
has one. But that's a good question, Zach. I don't know. Does this platform quote and enroll dental vision, or is it just the Medicare?
There are some supplements or supplementals that you can enroll through Sunfire. It is somewhat carrier dependent. So that's kind of like the caveat there. Sunfire basically works with carriers directly to allow those carriers to enroll their products through the platform. So there is a little bit of back and forth. We can always advocate for it as well, and that's something that we're actively doing. But there's some give and take there for sure. But yeah, you can see
I guess
how
like Humana dental and vision would probably be on there.
Yeah, I would say the bigger ones will probably be on there. You can also see things that you're not appointed to sell by unclicking this box here. Because it's a demo account, it's a little tricky. But yeah, let's see. Dental vision and hearing. Yeah, so here's some plans, dental vision and hearing, but it'll link out to the carrier portal to complete the enrollment for the time being. Like I said, this is something that we're actively targeting to improve.
Okay.
You guys are my questions, so thanks. This has been really helpful.
Yeah, absolutely. Absolutely. Any other questions? Any other things you'd like me to kind of touch on here, Ryan, before we wrap up?
No, I have nothing left. I think this is a great start. I'll talk to you offline about doing credits and stuff for future stuff when I
Sure.
have time, but I don't think it's anything I need to worry about urgently.
Okay, sounds great. Zach, Karina, I definitely encourage you guys to reach out to support@sparkadvisors.com if you need any help contracting wise. Like I said, that email address automatically routes to the correct person. So if you're reaching out about contracting, it'll show up in front of our contracting team. But yeah, our goal is to get everybody ready to sell as quickly as possible. So however we can support that, we are more than happy to.
Sounds good. Thank you for your time, Sam.
Yeah, of course.
Thank you.
Thank you both for joining, and the rest of the team, I'm sure I'll talk to you guys soon.
Great. Thanks, Sam.
Thanks, Sam.
Thank you. Take care.
Bye.